Good evening. I am Theo Slater, the national chairperson for the California National Party. The California National Party endorses SB 562 as the right solution for the healthcare affordability crisis in California. Waiting for the feds to take action or fix a problem is an exercise in futility, akin to waiting for Godot. Thank you and have a good evening.
Thank you, sir.
Hello, my name is Dave Marin. I'm the Director of Research and Policy for the California Freedom Coalition. We're a nonprofit that fights for more autonomy and independence for California. And on a personal note, my wife is a nurse practitioner who works for San Francisco General, and I think the presenter's point about the United States overspending on healthcare and underspending on social services would resonate with her. I think we need to stop acting like the federal government is our partner in healthcare. At best, they're a frenemy, if not an outright adversary. We don't know what they're going to throw at us. And our state needs to be agile to respond. But according to the way our state constitution is, our state government is anything but agile. It has its hands tied. It has its hands tied by Prop 13, by the GAN limit, and by Prop 98. And so even something as simple as the federal government cuts taxes and we say, no, rather than a tax cut for the rich, we would rather have health coverage and we're going to raise state taxes by the same amount. Even that is really difficult in California. So I have some good news for you. You can support the Healthcare Roadblock Removal Act, which I helped draft and which the Enact Universal Healthcare for California is trying to put on the ballot. This would reset the state government, at least for healthcare, back to the way it worked in 1977. And then there's also, you should know about Prop 10, the Children and Families First Act. By amending it by majority vote, you could put on the ballot before the voters a tax which would fund healthcare services for children from prenatal to age 5. If anyone doesn't have this in their packet, I can get you a copy. I don't know if I can leave them here.
Yes.
Okay. But I heard Dr. Ambula talk about, sort of the constitutional right to healthcare in California. I think it starts out with the right to have a state government, an elected state government that can make hard choices about taxes and the size of government, the size and scope of government, and be held accountable for those things. And to have that in California, we need constitutional change. We need Democrats to use their supermajority to untie the state government in some ways, put these things on the ballot, take us out of the late 70s,